just a couple of slides just to give you an overview of what it is that we're looking to do and try to put a little bit to this. I think probably everybody here uses email, one sort or another. This would be essentially an email inbox that might be for my patients. You can see it's sorted alphabetically here, but you can sort it just like with your own email. You can sort it any number of different ways, by type, by date, like this, where all of the appropriate clinical information on patients of mine, either items that I've ordered or items that have been ordered where I was copied on them, would come into me into a fairly, conceptually a fairly standard inbox. I would then be able to have that information as soon as it became available through the various information systems, radiology reports, dictated notes, admission notes, discharge summaries, operative notes, prescription requests. Those can all be brought into the inbox and made actionable. So I can act on them. I can assign it to one of the people in my staff. I can forward it on to one of my partners if need be. There's plenty of opportunities as with other email systems. Now, let's see if I can get that. Can somebody click that forward one for me? Thanks, Deb. So this is coming at it a different way. This is with a given patient, Rex, up there you see in the upper left. This is essentially a clinical summary of Rex. All the different things that have gone on with him, including various different laboratory results, things that have been acted on or not, by who ordered it, who his primary care physician is, where it came from, and date and time. This is, again, for you picture, because I'm a specialist, I'm an orthopedic surgeon, somebody gets referred to me as a new patient. It happens, daily. The ability to then have all of this available to me as I'm first meeting them, obviously very, very valuable. She'll give a great summary as to why. But you can picture this is part of the everyday. People end up filling out the different forms when they go to the doctor's office. There's all sorts of opportunity for cutting down on the redundancy, both on the financial side, clinical side, but just on the paperwork side of things. So this, again, everything on Rex can be done in reverse chronological order. If you would, let's see if I can get that. Oh, there we go. So this is sort of a snapshot summary of another patient, William, where he is, what the eligibility is, that is what the insurance coverages are, what allergies have been documented, what medications there are currently, problem list. All these are the sorts of things that are really part of that definition of meaningful use that got described earlier as part of the Reinvestment Act this year. It happens to turn out that we've been working our way towards this, and the timing worked out peculiarly well. Who knew? This is, it's just one of those sort of funny things where we've been working along on this because it seemed like a good idea. As hopefully it's obvious to everybody here, and that if you can do this, why wouldn't you category? And then it turns out that we're going to be able to get quite a bit of support in our effort as well. So this is how one does a prescription. This is the story here. There was a prescription done that wasn't on the formulary. There was going to be a large copay perhaps for the patient. This is an e-prescribing application, the ability to do electronic prescriptions. This kicks out a variety of different generic options that I can choose from, or not, and simply go because I really want to have that particular medication, but it's a way for us to be able to both keep track of that. So I'm not writing a prescription, the patient's going to the pharmacy is then saying, you have this huge copay, the pharmacy's calling my office, I'm not there anymore, I'm not in the operating room. You can picture the huge amount of steps that are involved in that are remarkably inefficient. And this is just another opportunity for us to, I think, enhance the efficiency of patient care. This is what you end up with. Again, a prescription here that can get sent to a couple of options. If you want to print it, you can go ahead and print it out and hand it to the patient. If we already have their pharmacy that they use in the system. We can just confirm it, and if that's correct, it can be sent electronically to the pharmacy, and then it gets saved to their record. So this is, again, just a very brief overview of what we're going to be able to do. And if you compare this to the story that Cheryl just shared, and she's got some wonderful graphics of her portable medical record, great photographs of boxes, paper boxes, and we were kidding earlier, I think you've now upgraded to Tupperware, right?
Yeah,
plastic bins for her portable record. And as I've started asking around, and feel free to do this yourselves, you'll find that she's not alone in doing this, though frankly is in a minority in that she actually keeps track of it. A lot of people don't. They just show up and they hope that their memory will suffice, or they just hope that they're not going to have another encounter like that. And the more complicated it gets in terms of medical care, far and away the more complicated it gets in terms of being able to keep track of this. It's just a great story and great example, and hopefully a striking counterpoint to what we're looking to do